Hello, thank you for attending this presentation. Today I will be talking about a systematic review that me and my research team had done, looking at the sexual and reproductive health, information and service needs and preferences of young people in Sri Lanka. So my name is Medhavi Weerasinghe. I'm a PhD student under the Monash University School of Public Health and Preventative Medicine, particularly in the Department of Global and Women's Health. The systematic review I'll be talking about today was completed as a part of my PhD project, and this study was undertaken with the expert guidance and supervision of a research team including Ms. Chetana Muduna, Professor Jane Fisher, Dr. Shelley McCliffe, Dr. Jagari Sastry, Dr. Neelamani Hevagigana, Mr. Karan Vashni, and Ms. Lorena Romero. So the systematic review we did aimed to synthesize and analyze the evidence on the sexual and reproductive health, information and service needs and preferences of young people in Sri Lanka by looking through secondary published data. So to do this, we collected data for this study. We conducted electronic searches across 4 databases, which were online, including Ovid Medline, Embase, Global Health, and PsycInfo. We developed a search strategy using a combination of subject headings and free text terms focused on 4 domains. So these included location and population, which was young people in Sri Lanka, so aged between 10 to 24 years. Topic of research, which was sexual and reproductive health topics, which we identified through a pre-real literature review. And key outcomes, which was relating to information, service needs, and preferences. These searches were adapted and appropriate to specifications of each of the 4 databases used in the study and was run at the beginning of January 2024. So the references used in this study were from the beginning we identified at the beginning of this year. The reference list of the articles included in the systematic review were hand-searched and cross-checked to identify any relevant studies not captured through the database search. Citations were retrieved from searches and uploaded into Covidence when the title and abstract were screened for eligibility for data extraction from the research team, by the research team, and this was done according to the inclusion and exclusion criteria which has been detailed on this slide. Following this, we extracted data on the research design, participant characteristics, and key findings from all studies which had progressed to the data extraction stage. Furthermore, we assessed the quality of studies, which were included in the systematic review, using the KMEC quality assessment guidelines. So the database search identified a total of 1,210 articles. After applying the exclusion criteria, data was finally extracted and analyzed from 16 studies, which were included in this review. In total, quantitative data was collected from around 19,531, and qualitative data was collected from 32 young women and men. Furthermore, there were 13 quantitative studies, 1 qualitative study, and 2 mixed method studies included in the review. Studies were conducted across urban and rural Sri Lanka. However, there was a lack of ethnic diversity in study participants, as all but 1 study had a clear Sinhalese majority. The topics which were researched included sexual health, reproductive health, pregnancy, and menstrual health. Due to heterogeneity among studies in areas such as sexual and reproductive health topic researched, the data collection tools used, and the interpretation of key findings, a meta-analysis was not possible. As a result, we carried out a hybrid inductive and deductive thematic analysis to synthesize qualitative and quantitative findings. According to this analysis framework, we identified themes in the wider literature, which was noted in a codebook and used as guidelines to deductively code, analyze, and organize data extracted from studies. Furthermore, while coding, we found new concepts and ideas which emerged from the extracted systematic review data, and we added these themes which were developed inductively to the codebook as well. We used this final codebook to analyze all data. So I'll just now move on to the results. So when looking at the sexual and reproductive health, information and service needs and preferences of young people in Sri Lanka, we found that young women are more likely to seek out information compared to young men. However, both young women and men preferred to receive information and care from informal sources such as their parents, particularly their mothers, as well as their peers. They were less likely to use formal and more reliable information sources and services such as healthcare providers and schools or teachers. So mothers were a vital source of information for young women, particularly on topics relating to the development aspects of their reproductive health. For example, we found that when young women experienced their menarche, they usually turn to their mother for advice on menstrual hygiene and pain management. However, when it came to their sexual health and discussing topics such as contraception, young women were most reluctant to go to their mothers for information as they feared they would be misunderstood or judged. On the other hand, both young women and men frequently turned to their peers for general information on topics considered to be more socially taboo, which they were reluctant to discuss with an authoritative figure such as healthcare providers and their parents, as we discussed. These included topics such as sexual health, but even with peers, young people reported that they were hesitant to discuss any major or personal health concerns as they are afraid that they will be bullied or ostracized. When it came to sexual and reproductive health information provided through schools, we found that studies usually reported on teachers as information sources separately from the school system and school curriculum as an information source. So when it comes to the teachers, we found that young people did not feel comfortable discussing their sexual and reproductive health with school counselors or class teachers, as they were afraid that they would be reported to senior administrative staff and would be discriminated against at school. On the other hand, we found that for some students, the general reproductive health lessons that they received as a part of the school curriculum was where they gained the majority of their knowledge on reproductive health. And so they found it quite important in terms of their knowledge expanding on the topic. That being said, there are many gaps reported in studies about the implementation as well as the content of reproductive health classes. For example, as reproductive health was usually taught through specialist classes to senior high school students, young people who had dropped out of high school early, who lived in rural and estate sectors of Sri Lanka, and who had not yet started their high school education had received none to very little reproductive health education through the formal schooling system. Furthermore, important reproductive health topics such as menstrual health hygiene and pregnancy prevention was not included in the school curriculum, we found. This was because classes were reported to be theory-heavy, focusing primarily on the biological aspects of reproductive health, which were usually taught through content-heavy textbooks. So, out of the 16 studies, 10 collected data on how young people perceived sexual and reproductive health services available for them. In terms of availability, we found that young men felt excluded from sexual and reproductive health services, as most healthcare providers and clinics were only specialized in the reproductive needs of young women. We also found that there were many factors which inhibited from accessibility of youth-friendly sexual and reproductive health services, and these included the costs associated with using such services, the fear of stigma and judgment, the inconvenient opening hours of the clinics, and some embarrassment on behalf of the young people. Finally, when it came to equality, the biggest issue was when young people attended sexual and reproductive health clinics, they felt like the healthcare providers were withholding information from them. Topics which were reported to have been avoided by healthcare providers when discussed or were not brought up to the young people included sexual and reproductive health, sexual health in particular, contraception methods, and pregnancy if the young person was not married. So the systematic review aimed, as we mentioned, to analyze and the existing evidence to understand the sexual and reproductive health information and service needs and preferences of adolescents and young people in Sri Lanka. So overall, one key finding was that young women were more likely to seek out sexual and reproductive health information compared to young men, commonly using informal information sources such as mothers and peers. On the other hand, the fear of judgment, the common practice of withholding sexual and reproductive health information from young people, and a shortage of accessible and inclusive youth-friendly sexual and reproductive health clinics were some major barriers why young men and women experienced when accessing information and services provided by schools or teachers and trained healthcare providers. So what does this mean in terms of recommendations? So there are two parts of the recommendations. Firstly, recommendations made by researchers of the studies included in the systematic review. So these recommendations included how sexual and reproductive health services and information and sources could be improved to better meet the needs of young people in Sri Lanka. And we got this from 15 out of the 16 studies, including the review. In summary, there were three key categories which nearly all of these author recommendations fell into. Firstly, many recommendations stress the importance of developing community training programs to improve the sexual and reproductive health knowledge and communication skills of parents, particularly mothers, so that they could provide more accurate advice to their children and especially daughters. Recommendations also called for the close collaboration between key stakeholders for the bottom-up development of information and services to reflect the changing needs and preferences of young people. Particularly, recommendations emphasize the importance of interprofessional training and collaboration between teachers and healthcare providers, both to upskill teachers and expand the school health curriculum. Finally, researchers called for the widespread promotion of formal youth-friendly sexual and reproductive health services and information sources across social media to increase awareness about what is available. So upon increasing awareness, they identify that young people are more likely to access what's available for them and not feel like they're left out from the sexual and reproductive health services and information available in Sri Lanka. So overall, the education of parents and teachers, increased partnership between key stakeholders to develop effective healthcare interventions, and the extensive promotion of available youth-friendly resources are key recommendations on how sexual and reproductive health information sources and services could be improved to better meet the needs of young people in Sri Lanka. When recommendations for future research, we found that future research should focus on the diverse communities to better understand the complexity and nuances of the sexual and reproductive health information and service needs and preferences of young people. This is because we acknowledge that there is no one-size-fits-all prescription to meet these diverse needs. For example, studies need to be conducted with young people who are completing higher education, of vocational training, gender and sexually diverse people, and youth from all different ethnic and religious backgrounds. Only upon understanding the diverse needs could sexual and reproductive health information sources and services truly be improved to better meet the needs of all young people in Sri Lanka. Thank you very much for listening to my presentation, and these are just the references.